Alright, we're going to demonstrate a dressing change. So first we'll gather our supplies, and we have 2 ChloraPrep cleansers, an ABD bandage, drain sponges, and 4x4 gauze for this dressing change. Every dressing change is different, but that's what we need for this one. We will go into the patient's room and we will introduce ourselves and tell them what our plan is, explain the procedure and answer any questions. Always want to check and make sure that the patient has had medication prior to beginning. If they have a painful wound, we don't want to cause them any additional pain. Okay, we'll do hand hygiene and make sure that they don't have any questions, and we've identified our patient properly, name and birthday, and explained the procedure. Alright, and then we will use regular gloves to take off the old dressings. And you may bring a trash can or have a trash bag available before you do this to dispose of the old dressings. And so we will expose the dressing here. Now, this dressing, or this guy here, he has a drain. This is called a JP drain. And ideally, if it was being used properly, it would be activated like this to create a vacuum suction, and it's draining fluid. So we want to be sure that we're checking that as well. Also, tape is very harsh on skin, and so we use, when we're changing dressings frequently, we try not to use so much tape or use a sensitive tape. And one way we can do that is to use these things we call Montgomery straps. Alright, so this is like a strap that we put on to the patient, and it stays on, and then we can hold it closed either with rubber bands, or we could thread gauze through here and tie it. There's a variety of different ways. Okay, so that way we don't have to keep putting tape on and off and on and off, and it's painful and can damage the skin. Okay. So now we're going to carefully take the old dressings off, and as we take them off, we're going to be looking to see if there's any drainage, how much drainage, what kind of drainage, if it's purulent, sanguinous, serosanguinous, serous. Alright, and then when we get all the dressings off, we're going to look at our incision. We're looking for redness, swelling, drainage, any tenderness if the patient says that it's tender. We're looking at the staples in this case to see if they're intact. If there's any areas where the incision might be coming open or dehiscing. Okay, and we're looking around the drain insertion site to see if that site looks good, and just see how the wound looks in general. Okay, alright, then we will take off these gloves and do hand hygiene again and set up our field here. Okay, so we'll put these in the order that we're going to use them. We will be using our swabs first, and then our gauze sponges, and then our drain sponge, and finally the ABD pad. Alright, so carefully open all of these things. And remember, inside the packages are sterile, so we're going to try and keep them inside sterile. Okay, so we're carefully opening these things. Sometimes these gauze ones are more difficult. Try to keep it open all the way. Okay. and the ABD pad. Okay, so now everything's open, and we're going to put on our sterile gloves. Okay, this is a sterile procedure. Any surgical incision is a sterile procedure. Some wounds are contaminated, and we might use clean procedure. You might see both in the hospital, but in this case, we're going to teach you sterile, and I want you to learn sterile. So you'll want to practice your sterile gloving. Okay. Alright, so we have our wound here, and we've assessed it, and we're ready to do the cleaning part now. So these ChloraPrep are kind of neat. When you activate it, you squeeze these two together, and that activates it, breaks the little vial in there, and sends the fluid down to the pad. Alright, and for ChloraPrep, they actually recommend that you can just scrub back and forth. We don't want to scrub from the drain onto the incision. We don't want to contaminate it, but we can just clean this back and forth like this. Alright, so now we've cleaned that, and then we're going to clean around the drain with the other one. So we will activate it, and then we'll clean around the drain, and we're going to take and go away from the incision. We don't want to come back over the incision, especially the part that we just cleaned. Okay? Alright, and now we're holding this drain tube here, and so this hand is not sterile anymore. Alright, so we're going to continue using this hand and gather our dressings. There's no reason to touch the dressings all over, we just need to touch the edges. And for this one, we're going to just fold that in half across the staples, and then we're going to put the drain sponge around the drain. Okay, and then lastly the ABD. Okay, and again, there's no reason to touch all of it, just the edges. We'll put it over the top. Whenever you have a dressing that has anything blue on it, it's always blue to the sky. Remember, the sky is blue, so the blue goes up. Alright, so we've put that on there. Remember, the outside isn't sterile, so you may see me touching this, but the gown is going to touch it and the blankets are going to touch it, so it's the inside that we're keeping sterile and clean. Okay? And then we're going to put the rubber bands back on. And we're going to be sure to document and label it. So I would probably take a piece of tape and put the date and time and my initials and just tape it right on the top of the dressing here so that people could see when I changed it last. Alright? And then cover this up and be sure that we put the bed down in the low position and ask the patient if they have any questions, and be sure to document. We're going to document all about the wound. And make sure that we have his call bite to him. Make sure we are documenting the response to the wound. And then any measures that are being tracked by the facility, like quality improvement measures. And this could be things like the prevalence of pressure ulcers. So the facility is probably keeping track, especially of hospital-acquired pressure ulcers, because those are the ones they have to pay for. And then they're keeping track of documentation and how well people are documenting. They're keeping track of education and how the nurses have been educated on changing dressings and documentation, and then referrals. So if there's a wound care nurse in the facility, then any wound should have a referral to the wound care nurse, and so they'll be tracking that also.